Okay, good afternoon everybody. I've been called to Mr. Ted Lee Bear. He's a very accident prone gentleman. He's burnt himself quite severely today, unfortunately, and he's dropped a couple of, large pot of boiling water over himself. So we need to cannulate him to give him fluids, and we also need to give him some pain relief. But unfortunately, due to the burns, we're not able to get a cannula in either his feet or his hands or any of his limbs. So we're going to use the external jugular to cannulate him. So coming onto the scene, we've checked for any danger to ourselves. We've cleared that, and we're also wearing our PPE, so goggles, mask, gloves, what have you. So we're going to explain to Mr. Bear what we're about to do. So Mr. Bear, we need to give you some medication. We also need to give you some some fluids. So we're going to put a little needle in your neck. It's not very comfortable, but it's the best we've got at this stage. Mr. Bear is supine, and if possible, we're just going to drop his head back a little bit to ensure we don't give a venous air embolism. If he doesn't have any spinal injury, so we can actually move his neck as we need to. So Mr. Bear, I'm going to use an 18 gauge cannula because we do have a lot of fluid to infuse, and it is a reasonable size vein. So we're going to I'll tell Mr. Bear what I'm about to do, explain the procedure, and get his consent. He is consented. So now I'm just going to move your head just a little bit to one side there, Mr. Bear. I'm going to swab the site. So using aseptic technique, swab the site, and then I'm going to have my sharps container ready to go. Swab the site, move his head to one side just gently. Then I'm going to put some pressure just above his clavicle on that side, and that's going to make that the jugular vein distend and pop up a little bit, which is done nicely, which is good. And just a little bit of a sting here, Mr. Bear. I'm going to insert the cannula and got a nice flashback here, and once the cannula is inserted, it's clicked. We're going to put that in the sharps container. I'm then going to occlude the vein with my finger, and whilst occluding the tip of the catheter and the vein with my finger, I'm going to get a one-way needle valve and place on the catheter. I can see that there's good refill into my cannula, and even just then I could see there was quite a nice flow of blood, so I'm pretty confident that we're in the vein. I'm going to now secure the catheter, and using my tegaderm, secure the catheter, and administer fluids and medications as per required. Thank you very much.